Hello, thank you so much for joining today. My name is Vanessa Carroll and I'm the Medical Director of Pediatrics at Kootenai Health. I'm board certified in pediatrics with over 15 years of experience in pediatric hospital medicine. I'm a clinical associate professor at Washington State University. I've held academic appointments as a clinical assistant professor at Tulane University and as a senior lecturer at the University of Queensland. I'm passionate about the health of children across our great nation, which brings us to today's topic of COVID-19 in children. So over the last 18 months, my colleagues and I have been asked many questions with respect to COVID. Our discussion today is going to focus on these common questions. How is COVID for kids different now compared to 2019? What are some of the symptoms of COVID-19 in children? Who's at increased risk for severe disease? What is multisystem inflammatory syndrome in children? Have COVID-19 pediatric patients been hospitalized at Kootenai Health? Is it safe to have my child vaccinated for COVID-19? How has the pandemic impacted my child's education? Should my child wear a mask in school? Why are pediatric admissions across the nation so high currently? And does Kootenai Health have a plan for the potential surge in pediatric admissions? So more than 4.5 million children have tested positive in the United States for COVID. Alpha was believed to be a less serious illness for children compared to adults, but Delta is different. Just last week, almost 2,100 children were hospitalized with COVID in the US. This is more than a 500% increase since July of this year. A large study out of Canada showed that children testing positive for COVID with Delta are more than twice as likely to be hospitalized compared to previous variants. The American Academy of Pediatrics reports the risk of hospitalization for children with COVID is about 1 to 2% in the United States. I do want to predicate, though, that this is region dependent, and we are seeing in the Southeast numbers as high as 3.5%. For children less than 12 years of age, they are vaccine ineligible at this time, but they're having increased exposure as more of the social safeguards are being unwound and they're starting to resume school or have resumed school in parts of the nation. So it's becoming a more dangerous time for them than previously. This slide does a nice job of differentiating Alpha from Delta. On the left in blue, we see Alpha, where one person could spread to about 2.5 people on average. On the right in gold, we see Delta, where one person is now spreading to 5 to 9 people on average. And this makes sense as the virus is evolving, right? It's trying to ensure it can replicate and spread. So this slide from the Centers for Disease Control shows new admissions of patients with COVID per 100,000 population by age group. I really just want to call your attention to the line graph on the left in gold that shows the data for ages 0 to 17. And really, if we look to August, we just see a massive uptick in admissions. So we've talked a little bit about what's going on nationwide, but what's going on here? What's going on locally with our children? Well, Panhandle Health reports that in the 5 northern counties for ages 12 to 15, 12% are vaccinated, while 16 to 17 years of age, 19% are vaccinated. Our total vaccination rate for all eligible ages, meaning 12 and older, is 39%. Now let's take this even more to a local level. Let's just focus on our Coeur d'Alene school district. So we're not going to include Lakeland, Post Falls, Charter, the numerous private schools in Kootenai County. We're just going to focus on our Coeur d'Alene school district for now. There are roughly 11,000 students in the Coeur d'Alene school district with 5,000 in elementary schools, so these are ineligible for the current vaccines. If we now average the current vaccination rate for ages 12 to 17, we have about a 15% vaccination. Now, if we take that number and apply it to those in our 6,000 enrolled middle and high school, we're still left with 10,000 students unvaccinated. Now, reflecting back on that American Academy of Pediatrics rate of patients with COVID who require hospitalization, we're going to assume 2% just to be conservative. We're not going to factor in this current southeastern data. We can anticipate from the Coeur d'Alene school district alone, approximately 200 children will require hospitalization for COVID. About a third of those hospitalized actually need an intensive care. So about 60 are going to need to be admitted to a pediatric intensive care unit or PICU. So again, please be aware that at the very least, you can probably double this number to estimate the number of school-age children in our county who are unvaccinated and at risk. So with this rather disturbing information in mind, we said let's take a survey of available pediatric intensive beds throughout our region. And we found the following. So we know Kootenai Health, we have no pediatric intensive care unit. Our friends in Spokane at Sacred Heart, they have 19. Down south in Boise, St. Luke's has 13. OHSU in Portland has 20. And Logan and Kalispell has 6. But I just want to make sure everybody's aware, some of these are double occupancy rooms, meaning that some of the rooms have 2 patient beds. Some patients would need to share rooms, which is oftentimes avoided for a host of reasons. However, really the biggest concern is what I think we're all aware of nationwide is the labor shortage. So having the rooms or beds does not actually mean that you have the staff available to care for those beds. But for our intentions right now, let's assume an ideal world. So all these beds are available and we have all the people to staff them. If we add up the available beds, based on the current projections, we don't have enough beds to even care for the Coeur d'Alene School District with COVID that require hospitalization, much less Kootenai County, or even those states that these hospitals directly serve. So we have a problem. So what are some of the symptoms that children will manifest with COVID? Well, a lot are very similar to the adults. So they can have a fever, cough, some shortness of breath, some body aches, headache, even some gastrointestinal symptoms. So who is going to be at a greater risk for having a severe disease or illness? Well, it is those children with comorbid conditions, meaning those that struggle with obesity, diabetes, chronic kidney disease, cardiovascular disease, chronic lung disease, sickle cell, immunosuppressed, or even technologically dependent. And by that, I mean, for instance, children that require home vents. So since COVID has developed, children have been recognized to have a unique manifestation, and this is that multisystem inflammatory syndrome in children, or MISC. This occurs about 2 to 4 weeks after the acute infection. It is a rare complication, but it does exist. When it first presented with alpha, believe it or not, children that had MISC were presenting in a very similar fashion to a disease that pediatricians are actually quite familiar with. It's called Kawasaki. And children with Kawasaki often present with fever of 5 days or more, a rash, beefy red eyes, some oral mucosal changes, meaning like dry, cracked lips or a really bright red tongue. They could have swelling of their hands and feet and even really big lymph nodes. The major concern with Kawasaki are the implications to the heart. So it can lead to coronary artery aneurysms. Well, we noticed soon after COVID arose that children were presenting with very similar features to Kawasaki, but they were older in age and they seemed far sicker than we had previously seen. There were very subtle lab differences, and their responses to treatment that had been established for Kawasaki were just not as effective. We saw these kids became sicker and unstable very quickly. My team and I actually saw a very healthy child progress into heart failure in about 12 hours in front of our eyes. So we early on developed a great respect for MISC. The current concern is that with increasing COVID cases, we're expecting to see increasing numbers of this MISC, and there are reports this is occurring. So what types of patients have been managed at Kootenai Health thus far? Well, we've had the respiratory patients, those that have had pneumonia with oxygen requirements. Some have had risk factors, but many have not. We've also had a neonate, so a baby less than 1 month of age who presented with what we call bronchiolitis. So it's the wheezing, the thick secretions requiring supplemental oxygen and suctioning. We've actually had a few of the MISC where, again, we just talked about one required transfer to a pediatric intensive care unit for heart failure. We've actually had another child present with mucositis or inflammation of their mucosal surfaces and a rash. So COVID is here and we have seen it and have cared for it. So understanding that children can get COVID and there can be significant consequences after. How do we prevent this? Well, we do have a vaccine and we have emergency use authorization for ages 12 and older. I know many of us are familiar that on August 23rd, Pfizer actually received full FDA approval for its vaccine covering those 16 years of age and older. There is an expected EUA, or this emergency use authorization of the Pfizer vaccine for ages 5 to 11, likely in September or October. Current data suggests that for children less than 12 years of age, that dose will be reduced from what the current dose is for teens and adults. And I say this really because a lot of physicians are being approached by parents or they're going to different sites and asking for their children to be vaccinated and they are not 12 or older. And we don't want to use off-label use as children will likely not require the current dose that is being administered. Their immune systems are far more robust, so they get a great response thus far with a smaller dose. One of the concerns, though, is out of a survey that was conducted nationwide by UCLA. And they talked to parents and asked them if they were very or somewhat likely to have their child vaccinated should this vaccine be released. And what is concerning is that less than half actually said they would. So having this vaccine become available is wonderful, but we have to make sure that parents are aware and are willing to use it. So there are clinical trials currently in process for ages 6 months to 5 years, and the current anticipated date of availability is sometime in 2022. The American Academy of Pediatrics recommends the COVID-19 vaccine for all eligible individuals. So what are some of the side effects that are commonly seen? Well, as with most vaccines, people can have some local pain, redness, and swelling at that injection site. Some may even have a little bit of fatigue or headache or temp or maybe some nausea. These are really relatively common with most vaccines and are not distinctly unique to COVID. Well, what are some of the vaccine side effects that are more serious? What are some of the things that have been reported? Why are people so nervous? Well, one of the things is you certainly can have anaphylaxis, as we can with almost anything that we're exposed to. With specifically the COVID vaccine, it's 0.0002% in the United States, so an exceedingly small chance. But this is also why doctors, after any vaccine, will have patients remain in their office for about 10 minutes or so just to monitor. So it does exist, it's just not very common, and we have a pretty good system in place to assess this. One of the things that you might have seen with respect to the Johnson & Johnson specifically is this thrombocytosis with thrombocytopenia. This is essentially some platelet abnormalities. What's important to note here is that this vaccine is not approved for children, meaning Johnson & Johnson, and this complication is really more identified in women over the age of 50. And then next, I'm sure many of us have heard about the myocarditis or pericarditis that has been reported with some of the Pfizer or Moderna vaccines that we're going to talk more about. So first, let me be very clear. Myocarditis is much more common and far more severe after a COVID infection than with the vaccine. However, with this in mind, there were reports that essentially in 0.006% of vaccinated individuals, some did develop some mild symptoms of chest pain, shortness of breath. They felt like their heart was racing, and it was sometimes seen more commonly in males over the age of 16 who got that second dose of the mRNA vaccine. The symptoms again were mild, and the majority recovered on their own or with minimal treatment. JAMA Cardiology reported that for males ages 12 to 29 years of age, this COVID vaccine has actually prevented about 11,000 cases of COVID, more than 500 hospitalizations, more than 100 intensive care admissions, and 6 deaths, compared to the 39 or 47 expected myocarditis cases. And what we mean by expected is we, in pediatrics and even in the adult world, see different causes for the heart becoming inflamed. Oftentimes it's viruses, can be medications. The point being there's a certain number that we see kind of regardless of certain triggers. So the point being is that, again, this virus, this coronavirus, is far more likely to be associated with myocarditis as an infection than with the vaccine. But it's important to present all the information and be aware. So some additional conversations involve fertility and the vaccines. So I will be clear by saying there is no evidence to support fertility problems in either men or women following this vaccine. It's actually recommended by ACOG and the CDC for women trying to get pregnant or those who might even become pregnant, as well as their partners. There is no increased risk for miscarriages less than 20 weeks gestational age. There is no decline in pregnancy rates across the nation. And this vaccine is recommended for breastfeeding mothers. One of the things that we encourage parents to do is to get their vaccines updated. And the reason behind that is that we are trying to create a cocoon by protecting the infants or those that are too young to become vaccinated, to avoid having that virus brought into their home or having them have that exposure. As the things that we vaccinate for, we do so for a reason, because their severity and their complications and even risk of death are quite high. So we want to try and encourage this vaccine for parents so that, again, the virus doesn't enter the home where infants and children are, where they are not eligible for this vaccine just yet. So how has the pandemic impacted our educational system? So we're going to focus on actually the business side of this conversation. So McKinsey is a well-known consulting agency, and they assessed kindergarten to 12th grade after the 2020 to 2021 school year. And what they found out is quite upsetting. They found out that our children are about 5 months behind in mathematics. They're about 4 months behind in reading. For those achievement gaps that are pre-existing and pretty evident in disadvantaged students, it's actually become wider. Our high school kids are more likely to now drop out of school, and they're less likely to go on to secondary education. A survey was conducted of about 17,000 parents, and they made sure to speak with people in every state just to make sure that we had good representation. And this survey, they asked parents, are you very or are you extremely concerned about your child's mental health? And more than 35% of parents responded, yes, we're very and we're extremely concerned. So unless steps are taken to address this unfinished learning, this interrupted learning in our schools, today's students are expected to earn about $49,000 to $61,000 less over their lifetime, owing to just this impact of the pandemic thus far on their schooling. There are reports that the U.S. economy, the impact could amount to 128 to 188 billion dollars every year as this cohort enters the workforce. So really, in conclusion, our children need to be in schools, and they need to be in a productive environment with an aggressive plan for this upcoming school year, because again, there is some unfinished learning that needs to be addressed. So this brings us up to the conversation of masking. So we've talked about the Delta variant, and we now know it is incredibly transmissible, meaning that it replicates very quickly in the body. So what do we do for those especially unable to get the vaccine? Well, this is where we need to talk about masking. So there are many studies which have focused on masking, but there are no randomized controlled trials that have specifically been performed to address if masks reduce COVID transmission in children specifically. Now, randomized controlled trials are the gold standard of testing, but it'd be really difficult to get approval for a well-controlled study that knowingly sends children into an environment unmasked with COVID while another group is masked with COVID. So while not being able to control all these variables, I do believe that our nation will be providing some information to us as we start to see schools open up with variable masking policies. The adult literature does show clear benefit in masking and social distancing, and the expert medical societies are reporting favoring masking. So the agencies that we are most respected in the medical community, the Infectious Disease Society of America, the American Medical Association, the American College of Physicians, the American Academy of Pediatrics, the American Academy of Family Physicians, and the Association of American Medical Colleges are all in strong support of masking. So in order to explore if there's a specific group within pediatrics that maybe we can focus on masking more so than another, is there a group, for instance, that maybe is transmitting the virus more than another? Well, JAMA Pediatrics actually showed that, believe it or not, teenagers are actually more likely to bring the virus into the home, but it's the toddlers and the infants who are more likely to spread it. And now this seems pretty reasonable, as teens, while they're more social, they're more exposed, they're also more self-reliant. So when they get sick, they generally tend to separate and, they can largely take care of themselves. But for younger children, they're more dependent on others. So when they feel bad, they're held and cuddled, and they have all these respiratory secretions that are certainly shared more and then in turn spread to those within the home. In summary, we really can't select one specific group over another to utilize a mask. We need everyone to mask. So to ensure an objective view, I do want to call some attention to things that have been voiced by parents and even some healthcare providers with respect to masking in children. Some people are worried that, children aren't little adults. So how do you extrapolate that information? And the school conditions are unique. They're in a longer day. Ventilation's different. Sometimes it's a more closed space. There's concerns about maybe the mask is going to lead to a poor educational experience. For instance, the fogging of the glasses, maybe some difficulty hearing as your mouth is now covered up. Is it a distraction? These are all very fair concerns and reasonable. But as we've discussed, we've established our kids need to be in school. And vaccination is really necessary for those that are eligible. But for those that are unable to be vaccinated, how can we get and help them to stay in school? What do we have at our disposal? Well, it's actually quite limited. Really, we need masking. We need to encourage social distancing. We need to make sure our environments are clean. Now, the future of our children is at stake. Is the risk of doing nothing worth the benefit? We just saw our children have physical and mental health consequences from this pandemic. They're having academic implications, and the financial implications for them are significant. What's really sad is that our children are almost being placed in a position, almost like a social divorce between the parents and the schools that they love. What is this going to do long term for their sense of trust? These are the issues we really just need to be aware of and talk about. So, we've spent some time talking about COVID as it's contributing to pediatric hospitalizations across the country. However, COVID and other viruses are actually leading to a significant increase in hospitalizations across the United States. So, respiratory syncytial virus, or RSV, is a very common virus and a common cause of hospitalization in infants and toddlers. It's responsible for a significant number of admissions. Roughly about 95% of people have had this specific viral infection prior to the age of 2. Last winter, though, pediatric hospitalizations across the nation were significantly reduced. RSV almost seemed to disappear, but it has come back this year with force. It is largely a fall virus that peaks in February, but it has arrived early and appears more aggressive than usual. It seems to be really capitalizing on the increased mixing of kids back in the community. One of the hypotheses as to why children had a less severe alpha COVID illness was that their immune systems are frequently being exposed to viruses. So children are oftentimes sick during those early years when they're starting daycare or preschool. Their immune systems are just having this frequent stimulation with all these repeated viral exposures. So it's suspected that some of these similar antibodies from previous infections may offer protection. Well, now, because children were not really exposed to RSV last winter, we're seeing an increased severity of RSV actually in even older age groups now. Pediatricians are seeing increased numbers in both clinics and hospitals. In talking to many of our outpatient colleagues, they're reporting winter clinic volumes in the summer. So COVID and RSV are leading to high numbers of hospitalizations, but we also need to be aware that there's an increased number of admissions for mental health issues. This is kind of that indirect effect of pandemic. We see children with anxiety, depression, overdoses, eating disorders. These are a host of reasons that admissions are as high as they are currently. On the left side of the screen is just a simple screenshot of pediatric hospitalizations across the nation and some of the headlines that were being reported just in the course of a day. And we can see that there are across the country a consistent expression of a similar sentiment of children being impacted by Delta and the infections in a very significant fashion, and it's leading to an increase in admissions throughout our nation. So now that we've seen what's going on across the nation, what is Kootenai Health Pediatrics doing in anticipation of a potential surge in patients when schools open, especially if there's inconsistent masking? Well, we're certainly concerned. We're worried about the increased number of admissions, again, based on the national trend that we just discussed. We do have care guidelines in place with respect to COVID-19 and MIS-C so that management can be based upon best practices and limit variability, which obviously leads to better outcomes. We're in constant communication with our outpatient pediatric partners so that they know what we're seeing and we're aware of what's going on in the community so that we can operate in partnership. Our nursing leadership has done an outstanding job of recognizing a upcoming need for pediatric beds in order to better serve our community. So they have helped to reallocate space so that we can care for as many children as possible. We've done a regional assessment in order to see what our PICU bed capacity is so that we can understand if those children do become severely ill and require an intensive care unit, where can we send them? Our teams have started undergoing additional training and refreshing of physicians, nurses, and respiratory therapists for non-invasive and, gosh forbid, invasive mechanical ventilation. So these are not cares that are oftentimes utilized, but they are used when respiratory distress and failure become evident. So we want to make sure that our teams are comfortable and aware, especially as we know COVID is largely a respiratory illness. With this in mind, we've also worked in partnership with our adult intensivists and our anesthesiologists to ensure that we're utilizing skill sets and that we can provide the best care to our community should ventilator and critical care support be required while again waiting transfer. And our concern is that beds are going to be at a limited number of availability as the region is likely to see this surge together. So we want to make sure and offer this care as effectively as possible. So what are some of the key takeaways? What are some of the things that I really want you to think about? Well, Delta is different for adults and children. Across the nation, pediatric numbers are up both inpatient and outpatient settings. Vaccination is our best means of limiting the spread of COVID. The mRNA COVID vaccines are safe and encouraged for children 12 years of age and older. The COVID pandemic has significantly impacted our children's education, and it's essential for them to be in school. With Delta's transmissibility coupled with the low community vaccination rates, our children are really at an increased risk of having further interruption in education and impacting their mental and physical health even further. Given a risk to benefits facing United States children, masks in schools are advised. The pediatric hospital admissions across the nations are increased not only due to COVID, but also RSV and mental health issues really leading to limited bed capacity across the nation. Based upon our current projections, the children in our region are at a significant risk for not having an available pediatric bed should inpatient care needs arise. Kootenai Health has a robust plan for the potential surge in pediatric admissions following schools reopening and the upcoming fall and winter. And lastly, Panhandle Health wants to make it easy for you and your family to receive the vaccine. Locations where vaccines are being given can be found on their website, and it's included right there below. So thank you all so much for your time. These are some of the reference utilized. I'll proceed to offer some additional publications following which explore mask wearing and mandates should anyone be interested. So thank you all so very much for your time and attention. I wish you and your family good health and a wonderful school year. Thank you again.